Hello, guys. Welcome back to the We Have Issues podcast. I am Matt.
I'm Carvell.
And I'm Chris.
And today we are going to continue our deep dive into the ASP platform. We are going to go down to item number 2. We talked about sanctity of life on the last episode. This episode, we are going to cover healthcare. Pretty obvious that healthcare is not working for really anybody, maybe the extremely rich. Certainly doesn't work for me or anybody here, I don't believe. So let's talk about how we can fix this. We are a very industrialized nation. We have some of the best healthcare technology system and education in all of the world, yet people seem to keep getting sicker. In this last election, that's led to some people supporting some alternative viewpoints like RFK Jr. So let's just go by point through our party platform here and discuss what the ASP believes about healthcare and how we think that we could fix it if we were to be in charge. So obviously, this system is not working as a kind of a hybrid system. There's people who do self-pay. There's people who have subsidized insurance. There's people who buy their own insurance. Kind of the general alternative that's always been offered has been universal health care. And I know that term has some bad connotations. There's some people that's had terrible experiences with it. There is prominent podcaster Steven Crowder has talked about his experience with universal health care being in Canada. The other day, Piers Morgan on his program talked about universal health care and its shortcomings in the UK. However, there might be ways that we can make this work in America. So let's talk about that first. So first thing that we would like to talk about is that we acknowledge that health policy must include regulatory protections for those with pre-existing chronic and terminal conditions, those who have no means to save for an emergency, and medical needs at every stage of life from prenatal care to hospice care. Kind of strikes a chord with me as I grew up with a father and a grandfather who had chronic conditions. Chris, Carvell, do you have any thoughts on this particular point?
I think, a lot of countries do it correctly, and we often wonder why the U.S. can't do it correctly. Why is it that we're kind of one of the most developed nations in the world? However, we're falling behind a lot of other countries that we should be ahead of in, how healthcare is being done, how healthcare is being taken care of. And a lot of it, kind of what we touched on in the beginning, or what you touched on, Matt, is that if you have money, you're able to kind of get the healthcare you want. Mm-hmm. And if you have a decent job, sometimes the job provides pretty decent healthcare, but that's not everyone. Not everyone in the U.S. has that access. Not everyone in the U.S. has the ability to pay for their own insurance out of their pocket and get the best doctors and get the best healthcare. And that's one of the issues that we're finding out very frustrating to solve. I mean, this has kind of been an ongoing issue since I've been in middle school, high school, and ever even thought about what healthcare meant, having good healthcare meant. So there's people that have pre-existing or chronic and terminal illness that they don't get the right treatment, they don't get the right doctors because sometimes they don't have the right health care. And that's definitely something that we need to kind of figure out how to better serve. I hear a lot of people complain about, obviously we all hear a lot of people complain about the healthcare system in the U.S. in Obamacare. I particularly don't have too much of an issue with it, but other people do. Maybe that's because I've only used the Affordable Health Care Act a couple of times for a couple of months, or a few months when I didn't have health care at all and I was jumping from job to job. But I've been fortunate compared to most people that the jobs I have had, one in the auto industry and two in my, working as a software engineer, that my company has had decent health care. So I don't have as big of an issue as most people, but there were times that I was a contract worker, and being a contract worker, I remember that in order to get health care through my contract company, it costs, I think, around $300 a week. And that was ridiculous. And the fact that there's a lot of Americans paying $300 and some a week, that's terrifying just to stay healthy. And then that's not talking about your deductibles. That's not talking about your copay. There's a
Were you getting, what is that, $14,000 a year worth of health care for your
no,
spending?
definitely not.
So like you would have just been better off to have been uninsured at that point.
Yeah.
And just putting that money away in the bank.
Yep.
And that's becoming a bigger and bigger reality with healthcare costs.
We're considering it.
Yeah, I've already committed to that, honestly, because I went through the public option, and the public option charged me $500 for a doctor's visit.
Yep.
That was obviously not the way to go. Private insurance, I was paying $300 a month, but I still wasn't using $3,600 in healthcare a year. So by my math, honestly, my best healthcare plan ever has merely been an HSA account. That has been the best healthcare plan I have ever had. It never denies me. It never tells me we can't do this procedure. It's just there. And the fact that HSA accounts are blocked behind this wall that is the healthcare industry is almost criminal, in my opinion. Because for most Americans, I feel if we are to stay away from this Medicare for all, if we are to keep to this privatization of healthcare, then everyone should just be able to get an HSA account, put their pre-tax dollars into it, use it for medical expenses, and be done with it. And you would have a healthier society overall.
Well, the first big criticism that everybody's going to lobby against it, Chris, is what about, major catastrophes? What about, chronic conditions and things like that?
Well, the people who would be using that are the people who can't afford the health insurance anyway. So the plan for that, I guess, is the GoFundMe. The GoFundMe is the emergency plan that probably a good portion of Americans have to rely on for these extreme medical expenses.
For now, I don't know, have you guys ever followed Dinesh D'Souza by chance?
I have not.
I am not an acolyte of his by any means, but I did hear a clip of him, and this is probably a year ago that I heard this. He had the idea, he proposed that you get $5,000 a year, tax-free, and that covers all of your expenses. And $5,000 is really generous because, I think what he had in mind is just general maintenance type things, like a yearly checkup, dental work, and things like that. So you got this $5,000 to cover just general. Hey, I need to go get a Z-Pack because I'm sick, stuff like that. And if you don't spend it, what you don't spend, it gets you get that at the end of the year. And then we have a universal system that covers catastrophic events, heart attack, cancer, things like that. Now, like I said, I'm not a Dinesh D'Souza fan. This was just a clip that I'd heard in passing, so I have no clue how he was going to work out the funding of all this. I'm sure part of the idea was if you have basically free money available to go to the doctor, you tend to go, you will get checked out, early screening, you'll catch these conditions before they spiral out of control. I found that interesting, and I've kind of always had that in the back of my mind when we talk about something like this, because like I said, that is the first criticism people bring up is this is all fine and good to spend your money out of your own account, but what happens if you have a catastrophic event?
That is one of the challenges that in policy is ensuring that people with pre-existing chronic and terminal conditions, that is the hardest part of the policy because these are the most expensive parts of the healthcare system, but it's also the most human part of the healthcare system. We are judged by how we treat the least, the weakest, those who can't do it on their own. And it's important. And I applaud the party for making that a goal. Though it is a difficult one, it is one that is so important to take and almost brave to the point compared to the cowardice that we see from the Democrats and the Republicans on healthcare. And the fact that they want to make sure that it is prenatal care to hospice, that from the womb to the grave attitude, that is pro-life. That is the entirety of your life. You should expect to have health care that you deserve, which is enough to keep you healthy.
I think in our system, there's something that it's part of the American culture, right? And this is the reason why we have trouble with our healthcare system is that we have this idea in America that is ultimately helped us flourish, but it's also been our Achilles heel, is that greed, right? Get money, make money, work hard for the money, get as much money as possible. The world evolves about money. This is the American dream. And that has actually helped us in a lot of ways in making us understand that, hey, hustle and bustle for the money. But where it doesn't help us is in situations like this, the healthcare industry. And I know everyone always points fingers at the insurance companies. But I also like to point fingers at the hospitals. Actually, I say they take most of the blame for our for the way the cost of healthcare and the way everything is perceived in America today. For an example, I used to live, as you guys know, I used to live in Taiwan and I used to live in South Korea. And I know a lot about the healthcare in South Korea. Why? Because I have some of my biggest accidents in South Korea. I had surgery in South Korea.
Ooh.
I was in the hospital. Wow. I had surgery, and I was in the hospital for over 3 weeks. Definitely over 3 weeks in the hospital. I had to get a huge cast. I tore my patella tendon. And I had somebody taking care of me. I was in the hospital for so long. I had a doctor do surgery, and I had health insurance. Typically, everybody has health insurance, and they're part of the national health insurance, and that cost me less than $3,000. You couldn't do that here in the U.S.
My kid, we got a bill for $3,000 to go get Tylenol. So
exactly. So, like, for an example, if you have a baby in South Korea, probably the most it's going to cost you is around $3,000. Probably the max of $5,000. And you're talking about any surgery that needs to happen. You're talking about if the mother needs to stay at the hospital for a prolonged time, whatever it may be. In the U.S., we're talking about $30,000. That is what the hospital is allowed to charge. So in South Korea, the federal government puts a cap on the hospital and tell them, you guys cannot charge more than this. And if you do charge more than this, that's not going to happen. We will help you subsidize. We will figure it out. But you're not allowed to charge the patients more than this certain amount. In the U.S., that is not the case. The individual pays for it. And you actually get a little bit more in South Korean hospitals. I mean, that's why you hear a lot of plastic surgeries, too, because it's much cheaper. A lot of people go abroad for these, surgeries or whatever, because the government puts caps on what hospitals are allowed to charge. So speaking about that, of course we need insurance, right? Of course we need insurance because these hospitals are able to charge a certain amount where the average, it will bankrupt the individuals. And when it bankrupts the individuals, you pay $30,000. Not a lot of people have $30,000 sitting in their account. And that's just if you want to have a baby. So you got to put that in perspective. So I think a lot of it has to do with the greed that we're dealing with inside the U.S. How a lot of people want to make money. And that's just part of the American culture. Now, skipping on to the insurance part of it, it's kind of sickening to me that we are allowing companies to make money on Americans being sick in such a way, becoming filthy rich in some cases off of the American people's, injuries, hurts, sickness, whatever it may be. But I mean, that's our culture, right? So not all of us are fortunate to get good health insurance. Like I mentioned, when I was living in Taiwan and Korea, I only paid I think for the national health insurance, I think I paid less than $1,000 a year. Maybe 2,000 max a year at the time I was there, and I was a student, right? So it's billed as you're a student. Here, when I was a contract worker, as I mentioned, I was paying, $1,200 a month, and that's ridiculous. Luckily, I have better insurance, but what happens when you lose your job? I've been on Medicaid before, and Medicaid is good. It's very good, but not everybody can or should be on Medicaid because it breaks the system. I was on Medicaid for about a year. I wanted to get off of it after a few months, but I couldn't get off of it. You had to wait a year. But so that was kind of the sucky thing about it, because I was like, okay, I no longer need Medicaid, so take me off because I want this to be provided for people who actually need it, and there was a 3-month period I really did need it. And so it breaks our system when we have too many people on Medicaid. And that's kind of one of those things that we really have to, as a country, start being less greedy, start being a little bit more logical, and have empathy for people who don't have access to good health care or won't have access to good health care, and just be smart about how we use the system.
Next point, we support efforts to help prevent the tragedy of self-harm, including universal access to affordable mental health care, destigmatization of mental illness, and the full funding of psychiatric institutes for desperate cases. So that's kind of goes back to what Trump was saying, bring the institutions back, huh? But no, I mean, seriously, I don't. So I suffered from, they call it health anxiety, used to kind of be rolled into hypochondria. But at one point in some of the readings that I did, people with health anxiety will go to the doctor for things that aren't emergencies, aren't even issues. And it said at one point we accounted for like 10% of what was being spent on healthcare, that's kind of shameful. I think that's a little bit high, but either way. And my point is, it's weird that primary care and health care, physiological health care, has kind of been tasked with taking care of mental health issues, which in my case, come to find out, there was a physiological problem, but it was much easier just to write me prescriptions for pills. But that being said, there are people who are relying on primary cares for their mental health. When I was seeing a counselor, they would not prescribe me anything, mental health drug, because I was about to move out of the state. And they said, well, just go to your primary care and they'll write the prescription. And sure enough, yes, I could go to my primary care and say, I want to try, whatever. And they would just write the prescription out and give it to me. No mental examination, nothing like that. It was just, they were just basically a pill farm. And so, yeah, we've got to figure out something to get these mental health cases out of hospitals, because they don't have the expertise. It's costly on everybody who is paying into the medical system.
I got a few thoughts on mental health care in this country. First off, it's not covered enough. Secondly, it involves a lot of times the treatment is just dope somebody up until they no longer show the symptoms, which makes them less desiring to continue taking the medication because it makes them feel like a zombie. And also, it isn't for their health benefit, it is for the benefit of society so that you don't have this person taking up a lot of resources. You just medicate them and keep them out of sight. Completely disrespectful towards the person and towards mental health in general. There's a few policies that I like to see take place. First off, I think that it should almost be like a mandatory thing that teenagers, for instance, should have access to mental health care, counselors, psychiatrists, that sort of thing, therapists. They should have access to those as part of every general health care plan, covered fully. Because these self-harm behaviors affect, not that they don't affect anyone at any age, but they seem to affect kids in schools disproportionately. And I feel that that would be helpful to focus on. Another thing, this destigmatization of mental illness. Another nation that had this big stigma towards mental illness in the past that has considerably gotten better is Japan. And Japan, they took steps because people weren't seeking mental health treatments in the day. And you know, Japan has a high rate of self-harm and all that kind of stuff for an industrialized nation. But doctors changed the name of mental illness, and they called it, I believe it was something like soul sickness, where like it heals you, like nothing's not you. It's like you have a cold. You are not like, you know, nothing's wrong with your brain. It's just your soul has been infected with an illness, and we are giving you treatment to clear that temporary condition out. Whereas before it was seen as something permanent and part of their character. So, you know, that I feel that would go a long way to help to kind of probably started in health classes in school, where it's like these mental conditions aren't necessarily chronic. They are periods that you can go through. You know, in a lot of cases, they are chronic, though. You know, there are people who will have anxiety for the rest of their life, who will have depression the rest of their life. But the worst bouts of these, you know, if we treat them like you can get better, maybe people will start taking steps and start getting better.
And while we're here on these points, Chris, do you think it would be better, cheaper for those mental health resources for young people to be offered through the school or through the actual medical industry? My advocating would be for it to be available on site at the school. I mean,
then we run into an issue, right? We run into an issue of how many therapists are there in this country right now? Are the schools going to pay a better rate than what they can get in the private sector? You know, I mean, possibly one thing we could do is one of those student loan, reimbursement programs, where if you are a therapist and you serve at a school, at a high school for X number of years, or in a school district, you could probably get away with, I would hope you could probably get away with one per school district, you know, maybe more for depending on the needs. But you go to this school district and you are the therapist on call in that school district, and you work for this salary for 10 years and your student loans are cleared. Something to encourage people to go into this industry, because I think that's going to be your biggest issue. Is I do not think we have enough medical healthcare professionals for the amount of people who are suffering from some sort of mental condition.
Yeah, well, we kind of have a similar issue in the trades. You know, we're having problems fulfilling HVAC technicians, plumbers, and things like that. And one of the things that I keep advocating for is you shouldn't have to jump through the hoops to become a journeyman plumber just to do repair in a home. I mean, it's a lengthy process. It's almost like going to college. And that's the problem, is it is this lengthy process when, you know, if you can't figure out how to do plumbing repair within a year, then it's probably not something you are geared toward anyway. So what about like life coaches being in the schools? Because with my issues, I went to actual therapists, psychiatrists, actual, health professionals. What helped me the most was a freaking life coach on YouTube, watching his videos. And so I just think that would be an alternative if you could free up the industry a little bit, if you could have just a simple life coach to talk kids through some of this stuff.
Honestly, that kind of leads into my next point almost, where I was considering, this is just a thought that I have. I'm not committed to this in any means, but I've been seeing artificial intelligence, language learning models, AI, the new thing. I was thinking about that as a tool to perhaps help with this kind of mental health crisis.
Hold on.
I know where you guys are thinking, but like, let me cook. All right. So,
all right, cook.
All right. So, I do understand the hazards with that of being unrestricted and unsupervised. My whole thing would be creating not just going to ChatGPT about your feelings. There would be a specifically designed language learning model that would stand in as a proxy for a therapist for daily, weekly sessions that someone could log into the account, have a chat with the chat bot, and then you would have different parameters set into that program where if this person maybe brought up a lot of self-harm ideation, that would flag it. So then a real therapist would then schedule a meeting with that person so that we could take advantage of the tools that we have where some people just need, like you said, Matt, some people just need that life coach, just need that person, that someone there to talk through their thoughts. But sometimes you need to bring in that master plumber to do the job, and then that would be done. So then then the lack of healthcare of therapists wouldn't be an issue, and we could use our resources properly and efficiently for the best health outcome for everyone.
I think that solution would work out best for the newer generations, not even Gen Z, right? Maybe Alpha, or maybe the generation.
We're still in Alpha. The next generation hasn't happened yet.
Oh, it hasn't? Okay. No, are you sure?
Yes.
I think.
Yes.
Okay.
Yes, we haven't gotten there yet.
Okay. All right. You're probably right. But the reason I say that is because, the people, think about us, right? The moment we know that it's an AI we're talking to, we just don't feel that connection as much. It's kind of like playing against the computer, right? Playing chess or playing, Super Mario Brothers or whatever against the computer. We know that the computer is good, that they can beat us, but it's just missing that human element that we're like, man, I want to play against somebody else online or talk to somebody else online that I know that actually I can compete against. My approach, my response to that would be, if you're not getting any health care, if you don't have any access, this is better than nothing. I mean, I guess.
Because there would be nothing stopping someone from getting a health care plan that would give them the direct access to a therapist if they needed that human connection. Some of these chatbots are getting so complex now that you could almost get away with that, with having, I don't know how morally or ethically acceptable it is, but you could almost get away with maybe the person doesn't know if it's talking to a chatbot or not.
Oh, that's wrong. No, man.
Well, that's what I was saying, though, right? If they don't know they're talking to a chat box, then yeah, sure, it could work, but that's not ethical, right?
Is it? Is it not?
It's not ethical.
If they're told up front that you may be talking to a real professional and you may be talking to a chatbot,
So like, kind of like rolling the dice, right? Like,
I
hey,
mean,
you don't know what
you
you're
never
getting.
know. You never know. Like,
But what if like a connection is like, what if you develop a connection?
you should
right?
never develop a connection with your therapist. Right?
Well, you shouldn't, but
right.
it happens.
It happens, right? Yeah, it does happen. I mean, like a therapist is someone you just come to and you open up to and you tell them like everything, right? Mm-hmm. And then like you later find out, hey, like the person I've been talking to is not even a real person, like how can they sympathize with me? Then it becomes like, man,
I don't know. This is why I'm saying, like, I'm just trying to find solutions for a problem.
All right. Well,
I'm not committed to it by any chance, but
no, I get it. I mean, it's all coming from the right place, and I think eventually, like Chris, I think you're right. I think we are going to be using in the future. We are going to be using AI tools to solve a lot of these issues that we can't solve right now. And it's because a lot of it dealing with technology. I mean, I don't know how AI is going to be a part. Maybe it's going to look like something like we're going to have a group chat. And the group chat, there's one of us that's an AI machine. Maybe they're taking up most of the conversation, but that group chat still exists, and maybe that looks like the therapist instead of having one person, they're having multiple sessions, and the AI is helping and aiding them with the conversation. Maybe that's what it looks like, and that could work, right? Because all AI needs to do is understand how I talk to my patients. Yeah. And all you need to do is probably 10 hours of video to really understand who I am, or I don't know, maybe 10,000 words in my emails or whatever to understand how I talk. And then there you go. You could pick up the conversation whenever you want to.
And I want to preface this, mind you, I do not want AI to be a substitute for a real therapist. I do not want people to be like, oh, well, if we have these AI chatbots, we don't need therapists anymore. I want to use a tool to enable those. I would love it if therapists if we had enough therapists to replace any kind of AI, and that we could have a reasonable cost for healthcare. But we have limited resources. We have to find a way to use those resources properly. I could pay 100 guys with shovels to dig a hole, but is that the right call when if I could just have an excavator dig that up? Is that worth it? I mean, that's where I'm at on that.
Next point here, this will be a good one. We propose that since the United States has the worst health outcomes of any developed country in proportion to the amount of money it spends, the federal government must negotiate pricing to end corporate exploitation of the captive audience of patients. To that end, medical licensing must also be reformed so that licensing supports quality care and does not impose straitjackets on healthcare workers or work only to support healthcare industry cartels. We call for tighter regulation of pharmaceutical advertising. Definitely needs to be something done about it. I have many friends that have worked in pharmaceutical sales and the pharmaceutical industry, and sorry guys, but you have too much money. And you make it in a very nefarious way, if you ask me. I don't like the idea of the government stepping in and telling you what you can charge for something, but we have price gouging laws for a reason, and I think we are at the point where we are price gouging. I mean, I've said earlier, we literally took my son to the emergency room. He had a fall. I was concerned. I wanted them to do an x-ray. Ended up literally giving him Tylenol, send him home, told us to watch for signs of concussion. We get a bill later for $3,000. Like, how? And I'm a big advocate of one of the best primary cares I ever had. When I walked in, they would give you a sheet of paper, and it's like, these are all the services that we offer, and if you're self-pay, this is what they cost. I think that ought to be legislation.
Oh my God. That would be the biggest reform in the medical industry is point of sale pricing. Like,
Well-
before I even get the care. No other industry, well, very few industries do this, where, like, could you imagine going up to McDonald's and saying, hey, I want a Big Mac meal. And then they give you the Big Mac meal, and then after you've eaten it, they go, oh, by the way, that was $50. What the hell? I wouldn't have ordered the Big Mac then. I'd have got the double cheeseburger. Like, but what they do is they don't tell you how much, unless you pay in cash. They're very clear to tell you how much it's going to cost if you're paying in cash. But if you're going through insurance, because there's so many of these little behind the scenes deals and subsidies and all this crap, you get insurance gets priced differently than cash does.
Right.
And that's wrong. Just charge a fair price to everyone. Yeah, I get it. The insurance can buy in bulk because they cover 1 million people and your cash only covers one person. But, you know, that's where the government steps in too, right? With that negotiated pricing.
Well, have any of you guys ever used like marketplace, like
yes,
Affordable Healthcare Act?
Yes, I used for like it was some of the worst. It was some of the worst healthcare experience I've had.
Really?
Yes, it was. I used Connect for a few months, and once we accidentally went out
what's
of network.
Connect?
Connect is the Kentucky healthcare plan.
Okay.
It's the one that it's the Kentucky group that's for the Affordable Care Act. We used that, you know, while we were in between insurance, and like I said, we went out of network once, and we got charged the $500. If we would have paid cash, we would have only probably paid $200. So they were. So this is another issue. With, I feel, to your point, Carvell, about the hospitals, and to your point, Matt, about, you know, the insurance and everything like that, is they know that they feel that they can charge more for these subsidized programs to make up for the rest of it. Because they know that the government has X amount of dollars allocated for this, and they're going to drain the government for all that money because they know that, you know, the fallout is, well, they know that the fallout's going to be bad.
I think that is one shortcoming of the Affordable Health Care Act is their inability to educate the users, because that is what my company and a lot of the companies I worked for in the past, they have these healthcare seminars. They make sure they put it in our faces like, hey, you guys got to know what you're buying into, and not only what you're buying into, you guys got to know which doctors you can and cannot go to. And they have a website, they have all this, and they go out of their way to make us knowledgeable because they know that, like you, Chris, you get those surprises like, hold on, you told me it was going to be this
surprises.
much.
They're not cheap.
Yeah, and you told me it was going to be this much, and it's this much. And so I think that's kind of a shortcoming of the Affordable Health Care Act. But one thing that I do appreciate about the Affordable Health Care Act is that as an individual, I've never used it as a family. If you do have like for an example, I deal with type 2 diabetes. I don't know if you guys knew that. The fact that if I went on an Affordable Health Care Act, I can get insurance. I can find a plan where my deductible is no more than $7,000, $8,000. Yeah. If I'm making a certain amount, right? And to me, $7,000, $8,000 is not going to be too much. It's a lot. Don't get me wrong. That's a lot. But it's manageable. If you have a lot of pre-existing health conditions and stuff, or, and type 2 diabetes, you're not going to even spend that much money, but you don't know what accidents you're going to have, right? So if I had my accident that I had in Korea here in the U.S., that's going to cost me thousands of dollars. Then I would be grateful that I had the Affordable Health Care Act. Paying $30,000 versus paying $7,000, that's a huge difference, right? If you're a pregnant woman, paying $7,000, $8,000 is a huge difference from paying $15,000. That's why it doesn't work for a lot of people, especially if you're healthy, but it works very well for people that are not as healthy. And also at the same time, the Affordable Health Care Act, you have this insurance that you pay monthly, but if you don't want to use it anymore, just stop paying and don't use it anymore. That's what I did, and stuff. That's what I did. I mean, of course, you have to put it in your taxes and tell them, hey, I used it from this month to this month, whatever. They'll check in, and if you made over a certain amount, you pay more money. That's just how it works. So sometimes it's it's like maybe Matt, in your case, if you're if you are a self-employer and you're making over $70,000, $80,000, that is taxable income, then it doesn't make sense,
Right.
But it just really depends on who you are. If you're making $30,000 and you can't get on Medicaid and you have conditions, it makes a lot of sense, actually.
And that was the biggest criticism of the Affordable Care. Well, in this case of the Affordable Care Act, one of the biggest criticisms was the costs that got tacked onto employers who were trying to, provide insurance to people. But that was the big criticism of it. Is, like you're saying, Carvell, perfect for, to put it crassly, poor people. Great program. But it wasn't. It was like, here's the ship, and we need to raise it up. Rising tide lifts all ships. The problem is, we were raising this tide over here by bringing this one down. And so that was the big criticism, was people who were making money were subsidizing this, quite frankly, almost inferior form of health care for poor people. Now, you could argue it's better than nothing, like you're saying, Carvell. In some cases, probably worked out fine, but that was one of the big criticisms. But something on this point that I want to point out is I don't necessarily agree with this part of the platform that the government should be negotiating anything. I mean, it's not the government's job to negotiate prices.
I think that's presuming a sort of Medicare for all situation where they would be using their monopoly, I guess, on healthcare as sort of a force where they just say, hey, we're covering to 300 million people. You charge us this. It's like you were saying with Walmart and TVs back in the day, right? That's where I think this part of the platform's coming from.
Well, and that's just like you're saying, that's assuming that we kind of got like this universal, Medicare for all program in place, but we don't have that. And honestly, I don't foresee that coming to fruition anytime soon. My point would be on this. We would be better off if the government capped, no negotiating. You can't really negotiate that. If they capped, said this is the most you can charge, then if there was a law where if you go in, you do have to present, this is what you're going to pay for these services. And we've kind of seen that in practice and what that actually does. If you remember with LASIK, when LASIK first came on the scene, it was between $10,000 to $12,000, I do believe. And because LASIK was not covered by insurance and there was no government involvement, there's no subsidizing of it, it slowly worked its way down into being very affordable. When I had LASIK in 2012, it was like $3,500, and it's gotten better and it's dropped. So I like that example because that kind of craps on everybody's criticisms. The capitalists say, well, if people aren't making as much money, the healthcare quality drops. That's not what we saw when it happened with LASIK. And the socialists say, we have to control everything. Not really. If you look at that, the free market actually handled that.
Well, I will add though that LASIK surgery, that is an elective surgery.
Yeah, that's a cosmetic surgery, right? You
will not die if you do not get LASIK surgery.
That's true. That's true. But remember, if it's capped, we're talking if everything is capped here, and you are actually having to show your prices, people can turn that down and go away. Now, yes, you are correct. If it is something that is immediate, that you must have, that's a necessary surgery. But remember, it is capped. So that's better than just running free range all over the place.
What would you guys think about? Curious. What would you guys think about if we had a sort of universal health care for urgent cares, but the hospitals were able to practice however they wish? And the reason why I say urgent care,
that just exists in any universal healthcare system. Unfortunately, one of the knock-on effects, though, is that you don't really have hospitals doing that because they find it is more beneficial to just like not be this private, unless it's like a luxury hospital or extremely wealthy.
I think a lot of times, like, we go to urgent care when we're not sure, right? Mm-hmm. Nobody's going to go to the emergency or the hospital like and check in if they're just like unsure about a type of illness, right? Like, oh, I got a cold. It could be COVID. It could be whatever. Let me go to urgent care. They're not going to go to emergency unless it's gotten that bad. What would so I guess that's more so my question. Like, the way the hospital systems are set up, we don't change that. But the urgent care systems, where there's a cap on, like, let's say for an example, Chris, like, there's like the accident you were talking about before. What did you say? You were taking your daughter to the hospital, or who were you taking to the hospital?
I was taking my daughter because she had a fever and
yeah. So let's say that you knew she wasn't gonna die, right? Yeah. But you were really concerned about this fever, so you wanted to take her to urgent care, and there's a cap. Like, the urgent care says, we're not going to charge you more than $120 just to be looked at and us to tell you, like, what she got. And they'll tell you if she needs to go to emergency room, right? I think that might be a system. Me personally, I think that might be a system that's better fit for the U.S. because there's a lot of times we go to the hospital for minor issues, but we're not sure, right? So we go to urgent care, and sometimes urgent care will still charge us a lot if we don't have health insurance. But there are other cases where we're like, okay, there's a huge issue, and this is going to mean emergency. We need to go and check this out at emergency.
I get what you're saying, but I think that I think that's already built into the system we have now. Like, people shouldn't be going. I mean, the hospital reception should be, if it's not an emergency situation, they should be redirecting you to an urgent care.
I'm very against AI, especially when it comes to this kind of thing. But this is one of those areas where it would be beneficial. There ought to be an app, and if the healthcare industry at large wants to come up with this, fine. Like right now, there's this whole thing where doctors.
It could be built into your Medicare for All profile that you have on that app that would do this.
Very, very, very fine. I mean, I'm fine with that. But doctors have this. You've heard the joke where it's like, what's the difference between God and a doctor? God doesn't think he's a doctor, and they get so pissed when you go in there and you're like, well, I was on WebMD or whatever.
Oh yeah.
And I'm like, we're trying to help you out, because if you go in there and you're like, I don't know, I don't feel good, then it's like, okay, well, where do we start here? Why not? There should be like an AI app. This would be helpful for that. Like Carvell's saying, where you can, here's my symptoms, here's everything about me, bam, what should I do? And in this case, it can say, go to the ER. Isn't that
taken care of in the form that you fill out, the patient form you fill out before you see the doctor?
Technology is moving quick.
But that's the point, is like, what if you, so like Carvell was saying, what if you end up at, the hospital and you put that in your form? It would have been so much better if you just put that into your little profile, because you have one anyways. All these backwood Ted Krasinski type people, they got that crap anyway. Stop worrying about that. Mm-hmm. Put it into your little thing. And it's like, go up to your local urgent care, probably just need a Z-Pack, and then you can go in and be like, hey, here's what it says do. I don't know. That would probably cut down on some people, because that, I said, I was one of those that was using up valuable health resources going when I shouldn't have.
Well, I think a lot of people are doing that, especially the younger generation, because they know they can't afford it, right? They're going to AI for medical. I mean, we see this happening now. They're going to AI for medical advice, right? Like, oh, I feel a little uncomfortable here. What do you think it might be?
Well,
and at the end of the day,
it's reasons like that I feel that I don't understand why the pharmaceutical industry should have any advertisement at all to consumers.
Precisely, I
To
agree.
patients. I don't see why. Like, I shouldn't go up to the doctor and say, like, I should take effluvia because I have, I breathe weird. And then that should be up to the doctor to be like, hey, because they have a patent on it anyway. Like,
so that's why I think I think this type of universal health care, which I kind of mentioned on, would actually benefit. It would benefit all of us more, right? It would benefit the users. It would benefit everybody, right? Because, like, let's think about it, right? If I'm going to the doctor, some of us, I might go a lot. You guys might go a little bit, right? So if I go to urgent care a lot and I'm like, I need to see, I'm paying a lot of money because I guess I must have like $500, $600,000, $1,000 to spend on urgent care, but you only need to go once or twice. And maybe those urgent care doctors, I know right now they can't, but maybe in the future they can give us prescriptions. They can say, hey, you have mild symptoms of this. We understand this. So this is what you need to take. And if they can do that, these pharmaceutical companies, right, they'll benefit too if you think about it, right? Because, you have people like me that are going there often and saying, hey, I have these issues, and I don't have health insurance. I'm not going to go to a doctor and get a subscription. But if I can go here and get, this kind of Tylenol or this kind of Wegovy, or whatever it may be, pharmaceutical companies are going to love that because they're going to be like, well, we're getting more people on my certain prescription and we're getting all the medications that we think these people need that the doctors are providing. I mean, it's a win-win for everybody, right? Mm-hmm. In a sense, obviously you can't do surgery or urgent care. Honestly, you can't deliver babies. There's a lot of things you can't do at a regular hospital. That's where, you have a different type of insurance or whatever that pays for, if I know that, hey, I'm going to have really big medical issues, then yeah, okay. I don't know. Maybe I'm going somewhere that in America we don't belong, but it's just a thought,
No, it sounds like you're trying to prioritize care into, to keep from flooding the main system is what I'm gathering from that. But yeah, I mean, that I wouldn't have a problem with that. We have the infrastructure for something like that in place. It just needs to be optimized, I guess would be kind of how I would look at that. Hey guys, we are running a little bit long. This is a very involved topic, many points that we're trying to cover here, so we will save the rest of this for a part 2. Well, thanks for tuning in. Please like, comment, and subscribe. I am Matt.
I'm Carvell.
And I'm Chris.
Thanks for watching.